Hi guys, Dr. Mark here. Okay, so I'm on duty here and it's nighttime and we already had 3 patients admitted so far into our ward. So there's more than one ward. There's 6 wards actually to be exact. And I wanted to talk about one of the patients that came in. It's interesting because I ended up in the emergency room. So about 4 weeks ago, the patient had a hip replacement surgery. And long term, the patient actually has problems with the kidney, has a chronic kidney disease and a chronic kidney failure. So long term, not just chronic kidney failure, also has problems with the heart and specifically atrial fibrillation, one of the very common problems in hospitalized patients. So this patient specifically is being anticoagulated with a warfarin type drug. So this is a vitamin K antagonist. And these are really old drugs. These drugs are problematic because they're very hard to set up and actually to administer and keep the internationalized normal ratio correct. So the INR rate is typically 1.00. That's what you should have for a normal coagulation pattern for a patient. But the prothrombin time, the INR in a patient who has atrial fibrillation and should be anticoagulated should be between 2 and 3. So this is difficult to set up. There's, as I said, it's a vitamin K antagonist drug, and it's actually, I was talking to my colleague about this, that it can be affected by so many different things, and it just anything from eating cabbage that has a lot of vitamin K, to getting antibiotic therapy, to actually the patient was interestingly actually had an infection. So this patient was for 30 years anticoagulated with warfarin type drug, and their INR ratio was great, and they were checked every 4 weeks. So you have to check it once a month. They had absolutely no problem for years. But acutely, after the patient was hospitalized for the hip surgery, the patient had some kind of an infectious disease, had some kind of a gastroenteritis. They had diarrhea, and the patient had diarrhea. To make a long story short, and they were drinking the same. He was drinking the same amount of water, and actually the blood concentration of the warfarin type drug became concentrated, and it went up from 2 to 6. And why is that a problem? So the patient that has a 2, they have a propensity to bleed, but the patient with 6, I mean, basically you can touch their skin and they already can have subcutaneous hematomas. If they hit their head, they can undergo intracranial bleeding. If they hit their stomach, they can undergo bleeding internally. So these are all very important values for you to keep in mind, that this patient went in, that without really any problems, and was undergoing the therapy that the doctor prescribed, and just by getting an infection, it threw the table over completely for them. And the long story short is, so what do you do with a patient such as this? So we admitted the patient. Actually, in the emergency room, he already got fresh frozen plasma. So the fastest way, guys, to correct the incorrect INR ratio, the prothrombin time, is actually through giving fresh frozen plasma. So that's something the patient got in the emergency room and is getting more of currently right now. Long term though, what else can you give? You can give vitamin K, actually really easy, and it goes the same for these Coumadin type drugs, these vitamin K antagonist guys. They're putting in, it's kind of like a rat poison, and they're trying to kill mice and rats with it, the farmers. And the problem is that sometimes the cats, they eat the mice, which actually ate the poison. And actually your cat is at risk, for your cat or your dog is at risk that if they ever eat a mouse or a rat who happen to eat this kind of a drug, is actually at risk for internal bleeding. And that's actually how they die. That's actually how they're killing the mice and the rats. The farmers are doing that because they don't want the mice to eat their food source. But it's something to keep in mind. That's actually the first and the easiest thing you can do, is you can go to the drugstore and you can ask for vitamin K. And of course, it's difficult to give a cat or a dog like vitamin K through the mouth. It's actually an effective way, but you can give it subcutaneously. Any way you can give it, it just has to get into the mucous membrane and it's absorbed into the body. So the long story short is that we're giving this patient fresh frozen plasma, intravenous vitamin K, because it's the fastest way actually for the patient to get vitamin K into the bloodstream. And so we're also monitoring the patient constantly. So there's going to be a lab currently. We're asking for a blood taken currently from the nurses. There's going to be one in the morning. And so what are we monitoring? We're making sure that the hemoglobin level is staying stable, because they can have internal bleeding. So we're trying to make sure that's stable. And we're also trying to see if we somehow normalized or stabilized their INR, their prothrombin time. And if their hemoglobin is stable, that means that they're fine. And if their INR is going into the right direction, you want to get them towards their therapeutic value. Depending on what kind of therapeutic value, we can do a whole nother video about that. That's not what this video is about. But what you need to make sure is that as they're getting close to their therapeutic value, you need to start thinking about anticoagulation for the patient, and what kind of anticoagulation. And then you have to start to decide, can they undergo low molecular weight heparin therapy? Then can you give a kind of a NOAC kind of a therapy, novel anticoagulant therapy? This is the time, as the level starts to normalize, this is the time when you start to do that. Guys, I hope you enjoyed the video. Long story short, I want to remind you to like, comment, and subscribe.